All right, what's up, crew? We got Devin in here. Devin is a chiropractic student, right?
Mm-hmm.
7th trimester.
Yep.
And so he's about to head into clinic. He stopped in today to shadow. We had a crazy day, busy with patients. Got to see some passive muscle work, adjustments. Got to see some active care with some exercises. We're gonna get Devin adjusted today. Stay tuned for some back, thoracic spine, cervical spine, lumbar spine adjustments. And Devin, we talked about no major injuries, right?
Nope.
Okay. What we're doing, palpating his mid-back, feeling on the right side of his mid-thoracic spine. He's got some muscle tension right around his T1, 2, 3, 4 vertebrae, kind of like what's called the CT junction, where a lot of people get discomfort from a couple things. One, posture, and if we're kind of like, you'll see in every video, a little bit slouched at the upper back. That's not him. He's a chiropractor. He does practice good posture, but he is working on clients all day long, so it's common for neck muscles to get tight, and really in the majority of the population, probably all of the population. So we're just doing a little scan. We're going to work on his right mid thoracic spine, left T1, T2 on the left right here is a little tender, and then his cervical spine, okay? So to start off, we are going to use the Hypervolt. We love the Hypervolt in our office. Number one, it provides therapeutic relief of muscle aches and tension, super quiet, which is awesome, and helps to loosen the muscles up, helps to improve circulation, and really immediately after just a couple minutes of treatment, patients say, wow, I feel nice and loose right now, okay? Important to note, this is passive muscle work, right? Passive musculoskeletal treatment. Using a device like this, we're just having him sit here. Now we could turn this into active therapy if we had him raise his arm and move through a range of motion, right? So we can very easily turn this into an active treatment if we wanted to, but for today's video, we're just gonna use this passively up around his upper shoulder girdle, the levator scap, the upper trap, and right around the superior angle of the scapula, where so many people get knotted up. Connective tissue and musculature from desk work, computer work, general postural habits throughout the day. Devin here just got done with 7th trimester, which is what, all the book work, right?
Yep.
Yeah, and now you're headed into clinic.
Yep.
Good. So in chiropractic school, there are basically 10 trimesters, and trimesters 1 through 3, you spend a lot of your time doing what? Gross anatomy.
All your basic sciences, chemistry, biochemistry, microbiology, all that stuff.
All right. Fun stuff to talk about when you're getting a Hypervolt treatment in your back, right?
Yep.
Trimesters 4 through 4, 5, 6, 7, a little more advanced with pathophysiology, more advanced biochemistry, a couple nutrition classes, and what else? A lot of electives.
Yep, you have, this is where you can start to branch off and to kind of get more of what you might want to practice in. So there are some soft tissue electives, there's some nutritional electives, and there are even like different named techniques that have their own electives too. So you really have a bunch of different choices as to what you want to put your education towards.
And what is there? There's like, I remember when I was in school, I think they told us there was like 600 or 700 different techniques.
There are so many different name techniques out there. People who might want to try and find names online, usually they'll find 2 big ones, Diversified and Gonstead. Those are 2 really common ones, and any other ones are just smaller named ones.
Yeah. So with Diversified, and this is turning into a great kind of like just a doctor, a fellow colleague discussion on school, on chiropractic therapy, chiropractic treatments, right? There are so many different kinds of chiropractors because there are so many different kinds of treatments and therapies that you as an individual, if you're going to chiropractic school or if you're seeing a chiropractor, if you're a patient in a chiropractic office, you may have been to a number of different chiropractors and each one is totally different, right? Mm-hmm. You probably have students in class that want to do a little more book work as opposed to exercise, right?
Yep. You definitely, I've known ones who are definitely going to be more towards the sports angle, and then the ones who want to put more of the nutritional spin on it. And then also the ones who want to just be more of the general family practice sort of thing. So
yeah. And really it's a different field. Obviously it's a different field than medicine, but if you guys, if you go to the hospital and you look at the hospital directory, you'll see that there's all different kinds of medical doctors, right? They all get the MD, but then they branch off into their specialty, whether it's obstetrics, gynecology, urology, general practitioners, neurologists, so many different kinds of medical doctors that, what do? They specialize in maybe one system of the body. A hematologist might be a blood doctor, right? An oncologist, a cancer doctor, and so tons of different specialties in that medical doctor degree. Doctor of chiropractic, same thing, right? Mm-hmm. There are, once you get your DC degree, you can be a general practitioner, really, or a general chiropractor, physician here in the state of PA, where you can treat kids, adults, elderly, athletes, non-athletes, doesn't matter who. And there's other chiropractors that focus specifically on, just sports and maybe just rehab. Look down for me. Devin is going into 7th trimester, so he's gonna really in the next year kind of branch out and figure out what kind of practitioner he wants to be, right, man? Mm-hmm. And just speaking, I've been in the field for 9 years now, graduated 9 years, working in the field 9 years. We have more of a sports-oriented practice. We own a gym next door. I'm gonna put this, can you unbutton one more button, right? Sure. So, other cool thing, quick tip, doesn't matter what clothes you have on, you can go to the chiropractor. We typically recommend athletic wear, which is why I wear like polos, some soft fitting pants. These are Lululemons that really allow me to stretch, bend, twist. And Devin's dressed up today, which is awesome. Look up straight, down straight, up straight, down straight, up straight, down straight, up, down. What we're doing here, a little myofascial release, as you've seen in some of the other videos, to his upper trap, levator scap, a little bit on his supraspinatus, and some of the erector muscles right up around the CT junction. He feels that thing right there, yep. Down, up, down. And what we're doing here, a little pin and stretch, myofascial release to help loosen up some of the muscles and promote circulation. Up, down, up, down, up, down. And for you body workers, massage therapists, chiropractors, physical therapists, anybody who's doing body work, one of the things I'm working on here in my own mind, in my own body, very mindful tricep lat activation, so I'm not scrunching up my neck, causing neck compression down for me. And so as I press through my thumb, I'm getting a nice big up, down, lat squeeze as to not cause injury or harm to my own body, right? So we're gonna get back to school talk here. But one more funny thing, we're gonna go right here. One more funny thing, kind of funny thing, not so funny when you're paying the disability bills, the disability insurance, but chiropractors have really high rated disability insurance. We use our hands all day long, and you can't really ever injure your hand, your neck, because if you do, hopefully you heal it, but there are a lot of people out there that have had injuries that might not be able to do their profession anymore because your body needs to be active, right? You need to be an active individual as a chiropractor because you are moving around, bending, twisting, and using a lot of hand muscles, a lot of arm muscles, and you do get sore. Not so much anymore as you train yourself, but coming out of school, once this guy starts seeing some patients throughout the day, he'll feel it, right? Takes a couple months. He's got a nice big thing right here. Feel that guy? Up and down and up and down. Good, man. All right, so did a little manual therapy on his cervical musculature on the left, cervical musculature on the right. Hit him with the hypervolt around the shoulders to loosen up upper traps, levator scaps, and now we're gonna get him adjusted. So let's go face. Oh, there goes this. All right, can I untuck your shirt here?
Yeah.
All right, we're gonna raise this right up to here, all right?
Okay.
Pick your belly up. All right, so as you've seen in some of our other videos, some chiropractors just focus on the bones. They just adjust and they might say, see you later, come back in a day, 2 days. They may see patients a little more higher volume than what we do, which different kind of practitioner. What I do in this office, what our chiropractors underneath us are trained on, is really 3 things. 1, muscle work. So we get in, we do some myofascial skin on skin. When we say skin on skin, that means skin on skin muscle work to help release some of the tension in his lower back, right through there a little bit. Now we're going to check out that right side. And so 3 major things. 1, muscle work to surrounding spinal and extremity musculature. And really, low back's not too bad. A little bit of, you feel that thing right in there, man?
Yeah, just a little bit.
A little bit of tension right there. A little higher up right here. So what I'm using my knuckles to just kind of scan his erector muscles, my knuckles right here. And again, we're engaging, Bree, if you want to shoot up here, we're engaging tricep, we're engaging lat, my shoulders down, I'm not hunched up, creating tension up in my neck. I'm mindfully working on a client or patient here and helping him to loosen up his low back muscles a little bit. All right. So after what, a minute, 2 minutes, all right, of myofascial release, to loosen up some of the muscles in the lower back, you see how his legs are already a little more balanced. We're gonna get his pelvis worked on, specifically the more on the right glute, right sacrum, a little bit on the left down in the lower SI joint. And we're just gonna hit his glute muscles to provide a little bit of therapeutic percussion or vibration using the hypervolt, which is currently my favorite device that we use here in the office. And these things have helped a number of patients. A lot of people, you can go buy these now and use them at home. We retail them out of the office. We have patients buy them and say, put this on your coffee table in your living room. If you have a spouse or a girlfriend or a boyfriend, you do 10 minutes on him or her and then you switch. And it's a relationship building, feel good device that is good for your health and ultimately helps your body to be better, stronger, faster, and looser, less injury prone. And we'll use this thing right over the SI joint right here. So Devin has the sacrum, everybody has the sacrum. Devin's sacrum's right around here. And we're just hitting his SI joints. And he feels this movement the whole way through. Sometimes even into the front of the pelvis where the hip flexors are at. All right. More check here. After we did a little sacral release, we're looking at feet length. Remember originally how crooked this guy was? His pelvis was twisted, his back muscles were imbalanced. If you live your life like that, you're going to have low back pain. You're going to have hip pain. If you do it long enough, you're going to start to walk around crooked, All right, so if you're ever out in the community, you see somebody that is walking around crooked, or their legs are out, or their head's crooked, that's because their posture, their skeleton, it's out of balance, right? So quick tip, pain pills and muscle relaxers and cortisone injections, 3 things, they don't fix your skeleton, okay? They may reduce your pain temporarily, but you gotta keep popping pills, right? And so if you find a good chiropractor, which they're all over the world, somebody that can teach you how to stretch, that can work on your lower back, that can help align or reduce tension in your pelvis, even your legs out, you're gonna walk taller, stronger, and be less injury prone. All right. Deep breath in, man. Exhale out, whole way out. Good, breath in and out, shoulders open. Good, and in and out. Oh, one more, boom, good. All right, let's do little. We talked about his CT junction, which CT junction stands for cervical thoracic junction. And he's got a little bit of tension right here still. We're gonna blast that right away. Oh, dude, adjust like butter, we'll say. Good. When we say you adjust like butter, that means your spine is just, it gets loose real easy. And when we loosen the spine up, it instantly helps to reduce muscle tension. Face over to the right side, up over to the window, okay? Lay on your left side. Bottom leg straight. And we're gonna twist him a little bit there. Good. Head is up towards ceiling. Deep breath in. Exhale out. We're checking out his, good. And one more, breath in and out. Good. Other side for me. And then we're gonna go right here, here, here. Deep inhale, deep exhale. Good. Boom, flattening your back. All right. Relax your feet for me. Okay, so this left IT band, one of the things we check, internal rotation of the hips. It's got a little more on the right than the left side that you can see. And we know that that left leg was the really short leg. So we're gonna hit, I'm gonna push, is that your wall? I'm gonna just push that over right there, that's fine. So we're gonna use the hypervolt again. Give them a little bit of therapeutic percussion or vibration into the lateral hip. And some of this is a little ticklish up here in the ASIS, the anterior superior iliac spine, the attachment site for a bunch of muscles. Good. And you want to laugh, giggle. It's ticklish in that area, but right away that helped loosen up some of his hip rotation, all right? Put your hands down on your thighs. We're gonna go easy on left. That's good already. CT, relax. And that's good already too. All right, man. So his neck, when we adjust his CT junction, we got a lot of movement. You got a little bit left right there. Let's do that right shoulder again. Lower that. There we go. All right, let's flip on your stomach again. Is that crazy? This is the end of the video. All right. What we did here today, 4 regions of adjustments. We did cervical adjustment, we did thoracic adjustment, low back, and we did right SI joint. We did some myofascial release pin and stretch technique up on his shoulders, in his erector muscles in his lower back. We didn't even really stretch this guy out or anything. That's just the passive chiropractic adjustments and the muscle work. We also use the hypervolt, and you see just after, I don't know, 6-7 minutes of treatment, we leveled his legs out, right? Which is really awesome. All right, you can sit up for me, dude. Spin to the left. And what we're gonna do now is educate him on some leg exercises. Oh man, feel those shoulders. One more adjustment. Let's do this right shoulder here. Palm this way. Good. And then that side's good already. All right. So muscle work, adjustments. One simple tip for him to leave with is called a lat press. Hand press down, both hands on your thighs. A little bit of pressure downward. Elbows in, shoulders open and down. Perfect, dude. Feel it in your lats, feel it in your tris. You'll hear us in all of our videos talk about the importance of back chain dominance, taking the tension out of the chest, out of the neck, improving his posture, improving the strength in the backside. Very important for long, healthy musculoskeletal system, long, healthy spine, and symmetry between the left and the right sides. So you saw this dude who's a chiropractor. He's sitting in class. Now he's going to clinic, so he's going to be up and active a little bit more, but came down, what, 8 hours or 6 hours?
6 hours.
6 hours. And his legs were a little off, little adjustment, little muscle work. You saw how the feet evened out. As a chiropractor, if the dude stays healthy and stretches, he's never going to have low back pain his whole life. That's what chiropractors do. We help you to get out of pain. We help you to move better. We help you to realize and understand your optimal potential, right? We get you to move and feel at your best without pills, without medications, without surgeries. What's the human body designed to do? Heal, right?
Heal, yeah.
Heal on its own. If you get a paper cut and you got healthy blood, your skin's going to regenerate. If we teach you how to stretch your muscles and develop better postural habits, lift with good technique, you're never going to hurt yourself. You're going to reduce your risk of injury. Cartilage and connective tissue is going to stay healthy for your entire life. And you can be 70, 80, nice and flexible, touching your toes with good spine posture. That's what we teach here at Turack Chiropractic. It's a pleasure having you.
Thank you for having me.
All right, man. We'll see you guys later. Crazy? This is the end of the video.